endoscopic characterization. And as mentioned before, the two aspects here are the surface, mucosal surface, and vessel. Yao proposed this long time ago, and it's called the VS classification, or the Yao classification, as we call it. There is either a regular vessel, irregular vessels, or absent vessels, as in this tumor. And the same applies for the surface. It's either regular, irregular, or absent. Here there is absent surface, and here it's irregular. So I would recommend to write this in the endoscopy report as well. So when you are doing the characterization, we follow the Yao classification. We look at the surface, we look at the mucosal aspects, and we also look at the vessels, and very importantly also look at the demarcation line. We will talk a little bit about that today. The demarcation line is the area where there is a border between a cancer and the benign lesion. Here we can nicely see the demarcation line, regular mucosa, irregular mucosa, and the demarcation line. And this can be proven histologically as seen here.